Intestinal polyps. Intestinal polyps can be non-neoplastic or neoplastic. Non-neoplastic polyps include inflammatory polyps, hyperplastic polyps, and hamartomatous polyps. Neoplastic polyps are adenomatous polyps. The hamartomatous polyps are subdivided into juvenile polyps and pit-sugar polyps. Juvenile polyps are more common in rectum and there is increased risk of cancers, whereas pit-sugar polyps are more common in jejunum and there is no risk of neoplasia. Juvenile polyp is seen in first decades of life and males are more prone when compared to females. This juvenile polyp is a pedunculated polyp and you can observe numerous cystically dilated glands. The syndrome that is associated with juvenile polyps is juvenile polyposis syndrome and it is associated with malfunction of the SMAD2 or 4 gene and transforming growth factor beta. There will be presence of multiple juvenile polyps and there is increased risk of cancers both in GIT and in the extraintestinal cancers also more common in this type. Coming to pit sugar polyp, it is, as I said earlier, the jejunum is most commonly involved. It is seen in 11 years age group, most commonly teenage group, and there is no risk of neoplasia. The syndrome that is associated with pit sugar polyp is pit sugar syndrome. There will be presence of multiple PJ polyps or pit sugar polyps, and there will be hyperpigmentation of oral mucosa and genitalia and lips. There is risk of esophageal or colon or pancreatic or genital cancers, and it is associated with STK11. Juvenile rectal polyposis, as I said, it is juvenile polyp in the rectal region along with cystically dilated glands, SMAD24 mutations seen in less than 5 years of age group, and there will be complaint of bleeding per rectum. And the polyp is a pedunculated polyp. Pit-Sugar syndrome includes Pit-Sugar polyp and pigmentation. P for pigmentation and J for jejunal polyp. There is STK11 or LKB1 mutations and seen in teenage group, mostly 11 years common, and there will be pigmentation of the oral mucosa, lips and genitalia and seen in jejunum. There will be a hematomatous polyp which is of arborizing type. It looks as a Christmas tree, so it is also called as Christmas tree polyp. In the picture you can see pigmentation over the lips, and if you see, this is a pedunculated and these are projections, papillary projections are polyp, pedunculated polyp, and they are arborizing of smooth muscles. There will be arborizing of smooth muscles. It is a hematomatous polyp. And in this juvenile rectal polyposis, you can see the cystically dilated glands. Hyperplastic polyp, it is not a pre-malignant condition. You can see serrations only in the upper part. Whereas in a sessile serrated adenoma, which is a pre-malignant condition, you can see the serrations in the whole thickness. If you see the picture, in hyperplastic polyp, only serrations are seen in the upper part. Okay, see how these are. There are serrations, right? They are seen in the only in the upper part. But in a sessile serrated adenoma, you can see full thickness of serrations. Full thickness of serrations. This is the basic difference between a sessile serrated adenoma and a hyperplastic polyp. Tubular adenoma. It consists of villosity which is very less, around less than 25%. Okay. Coming to tubulovillous adenoma, the villosity will be more, that is 25 to 75%. When you compare with the tubular adenoma, the villous part is more in tubulovillous adenoma. And in a villous adenoma, Total almost all are villous type only. More than 75% fraction of villosity is seen. These adenomas are the precursors of adenocarcinomas, characterized by the presence of epithelial dysplasia. They can be pedunculated, sessile, or slightly elevated, flat, or even there will be depressed appearance. Risk of progression to carcinoma when it is large size, high proportion of villous architecture, extensive dysplasia, and high number. So, villous adenoma is having higher chance for carcinoma, adenocarcinoma colon when compared to tubulovillus. And tubulovillus is having more chances than tubular adenoma. Okay. Familial adenomatous polyp or familial adenomatous polyposis is a autosomal dominant condition, and the gene involved will be APC gene and the chromosome involved will be 5q, and APC gene is a tumor suppressor gene. This everyone knows. So mutation of this APC gene will cause increased chance of formation of this adenomatous polyps. The syndromes that are associated with FAP or familial adenomatous polyp are classical FAP, Turcot syndrome, Gardner syndrome. In a classical FAP, there will be more than 100 adenomatous polyps and there will be involvement of the eye. There will be retinal pigment hypertrophy and there is increased risk of the colon cancer at an early age. Coming to the Turcot syndrome is familial adenomatous polyp. Along with that, CNS tumors like medulloblastomas and gliomas. So it is a brain tumor polyposis syndrome. The association is with brain tumors, medulloblastoma, and malignant glioma. Coming to the Gardner syndrome, it is familial colorectal polyposis or familial adenomatous polyp and soft tissue tumors like desmoid tumors, osteomas, fibromas, thyroid cancers, epidermal cysts, everything. So in the picture, if you see, these are all polyps. Okay. Are you able to appreciate? These are all polyps. So these polyps are more than 100. So this is a familial adenomatous polyposis or familial adenomatous polyp. This can be classical FAP or Gardner syndrome or Turner syndrome. In everything, everyone, it is FAP only. Along with this, if there are osteomas or thyroid cancers or epidermal cysts or fibromas, sebaceous cysts, desmoid tumor, then it is Gardner syndrome. Whereas if it is along with the FAP, if there are brain tumors like medulloblastoma and malignant gliomas, then it is Turcot syndrome. In this picture, you can be able to appreciate the cells are arranged in rosettes with a pink material in the center. So these are pseudo rosettes. Homer-right rosettes are pseudo rosettes of a medulloblastoma. Like, share, subscribe Dr. Ravichandra official for more interesting videos on pathology.